Good afternoon. We'll get started on this session, which is a breakout session, number 6. It's on revamping social protection and improving nutritional outcomes. We have 3 presentations in this session, 2 by Dr. Akhtar Ahmed and 1 by 2 of his colleagues, and we have a discussant, Dr. Imran Mutin. So for ease of seeing the screen, speakers and chair will be sitting with the audience in sequence, and during the open discussion we'll all go up. All right, so inviting Dr. Akhtar Ahmed to present Reforming the Social Security System in Bangladesh, paper 1. Akhtar.
Thank you, Dr. Rahman, and thank you all for joining us for the IPRI's second session. In this presentation, we will provide a high-level overview of Bangladesh's social security system. Oh, okay, yeah, thank you. Later in this session, we will dive into specific examples of how social protection can be used to improve nutrition. In Bangladesh, social protection initiatives are referred to as social security programs or SSPs. The country has extensive experience in using various safety nets and protection programs to support the poor and vulnerable. In fiscal year 2024, a total of 115 programs were operational. The government spent a large part of its budget on social safety net programs. In fiscal year 2016, it spent $4.7 billion, which was 14% of the national budget and 2.1% of GDP. By 2024, this rose to $11.8 billion, from $4.7 billion to $11.8 billion, about 17% of the budget and 2.5% of GDP. This increase shows a strong commitment to social protection, but also highlights the need to use these resources more effectively. In fiscal year 2024, the budget for social security programs was heavily concentrated among a select group of initiatives. Out of 115 programs, 28 major ones accounted for about 91% of total budget. The top 5 programs received approximately 58% of total budget. Among these programs, pension for government employees and their families received the largest share of the 2023-24 budget, representing 22% of the 2023-24 budget. Despite the substantial share of the budget allocated to the top 5 programs, they served only 6.2% of total beneficiaries of Social Security program. This highlights a significant disparity in budget allocation within the existing social protection system, social security system. Many programs have limited coverage and insufficient funding, failing to reach those who need the help most. The targeting errors are common, excluding vulnerable population while including those who are not in need. In 2024, 22% of the Social Security budget went to the government employee pension program, which primarily benefits the non-poor. Although 115 social safety net programs were active in fiscal year 2024, the top 10, excluding the government employee pension, absorbed 66% of the budget. This leaves resources stretched thin for the remaining programs, diluting their benefits for participants. Most of these programs have limited coverage, are uncoordinated, and are not adequately funded. Additionally, small benefits limit the impacts of many Social Security programs. With a focus on increasing coverage, the benefits provided by many programs have stagnated or remained very low. For poor and extremely poor households, these benefits often make up just 1 to 2% of their total income. So one example is this stipend for primary school stipend program, which started in the early 2000, and benefit, stipend was 100 taka per month. Still, they are getting 100 taka per month after so many years. So the real value of that is almost negligible today. So, but the coverage is very high. Primary school stipend program has the highest coverage actually among all safety net programs. Let's take a moment to consider how effectively Social Security programs are targeted. We often assume that these programs are meant to help the poorest and most vulnerable. However, many also reach wealthier households. These graphs, we have prepared this from IFPRI's BIHS, Bangladesh Integrated Household Survey sample. We see the percentage of programs beneficiaries across income group, with the poorest households on the left and the richest on the right. Programs that reach a higher percentage of the poorest household are better targeted to the poor, like the Open Market Sales Program, or OMS. So, what else do you see? The Open Market Sales and Employment Generation Program for the poorest are the most effective as in targeting the poorest, followed by the Alliance for Widowed, Deserted, and Destitute Women, and Vulnerable Group Development Programs. From IFPRI's BIHS sample of 2018-19, all OMS beneficiaries, 100%, and 64% of EGPP beneficiaries, and 61% of AWDDW program, they were from the poorest 40% in the income distribution. OMS uses self-targeting. It is technically open to all, but the long waits and stigma meant it mainly attracted the needy. The EGPP also self-targets by requiring heavy physical labor, making it accessible mostly to the poorest. Now, let's look at another key issue: the choice between food and cash transfers. Bangladesh has both food and cash transfer programs. The National Social Security Strategy encourages shifting from food to cash support. Cash transfers provide recipients with freedom of choice and give them a higher level of satisfaction. They achieve higher utility levels. For distribution, but food distribution is costly due to procurement, storage, transport, and distribution expenses. On the other hand, cash transfers are cheaper to deliver, but inflation can erode the value unless the government periodically adjusts the benefit levels. Food transfer protect recipients from price hikes since the value of food is constant. But the cost to the government rises with rising food prices. The shift from cash cash-based programs to food-based programs has some operational challenges. The public food distribution system manages food grain supply in the country with food-based safety net programs as major outlets. So to maintain quality, it must regularly rotate its inventory. We identified 5 programs that stand out for their strong targeting performance and potentially welfare effect. Vulnerable Group Development Program, or VGD. This is actually called VWB, Vulnerable Women Benefit Program now. Mother and Child Benefit Program, Old Age Allowance, allowances for the financially insolvent disabled, and allowances for widowed, deserted, and destitute women. Together, these programs account for more than 12% of total Social Security budget, excluding government pension, and support over 13 million people. We recommend substantial increase in coverage and budget for these programs. I would like to close with a few key recommendations for strengthening key Social Security programs. First, the Vulnerable Group Development Program could incorporate high-quality, intensive nutrition behavior change communication, or BCC training for women in each 2-year cycle. This would enhance VGD's impact by making it a more nutrition-sensitive social protection program. For cash-based program, there is a scope to enhance the Mother and Child Benefit Program, old age allowances, allowances for financially insolvent and disabled, the allowances for widows, deserted, and destitute women. Also, as many safety nets target the rural poor, expanding coverage to both rural and urban areas is crucial. Increasing benefits amount and implementing the government to personal GTP payment scheme, G2P payment scheme would also improve efficiency and impact. In urban areas, expanding the OMS program and TCV truck sale of food, subsidized food, during seasonal food price hikes would provide relief to vulnerable population. Additionally, introducing an urban cleanup program could offer income opportunities to the poor while contributing to improving city cleanliness. Thank you for your attention.
Thank you, Dr. Akram Ahmed. The second presentation is on promoting sustained poverty reduction and resilience through social protection. Again, presenter is Akram Ahmed. So, yes.
In the last presentation, I discussed some of the pitfalls of the current social security system and the need for its reform. Now, I want to shift our focus to what happens when a social protection program is done right, drawing on a rigorous evaluation conducted by IFPRI to illustrate this. I'm presenting this work on behalf of myself and my colleague, Shalini Roy from IFPRI, Washington. We already know that the government of Bangladesh makes substantial investments in social protection, and for good reasons. There is solid evidence that safety net programs with cash and food transfer can effectively increase household consumption and reduce poverty in the short run. The problem is that we know less about how to sustain these benefits and also, that is basically, provide graduation from this book once the program ends, okay? So some insights are clear. For example, evidence shows that program design matters. Factors like the size of the transfer and whether they are combined with other interventions or components can significantly amplify impact. So, IFPRI and WFP partnered to answer two key questions. Which safety net interventions is most effective for improving child nutrition? Can these interventions also enhance household resilience and women's empowerment over the long term? To find the answers, IFPRI designed and WFP implemented the Transfer Modality Research Initiative, or TMRI, a 2-year cluster randomized control trial targeting ultra-poor women in rural Bangladesh. Under TMRI, participants received monthly cash or food transfer worth 1,500 taka in 2012, approximately a quarter of household income in that year. These transfers were provided either alone or combined with group-based intensive nutrition behavior change communication, or BCC, delivered weekly throughout the 2-year program cycle. Many previous studies attempting to improve child nutrition through social protection showed limited success. However, IFPRI's evaluation of TMRI revealed remarkable results. Combining cash transfers with nutrition BCC significantly improved child nutrition status and sustained these benefits over long term. Not only did nutrition improve, but the decline in stunting among young children of mothers who receive cash plus BCC were three times greater than the national average decline in stunting. 3 times. However, mothers who received cash alone didn't see the same improvements as those who received cash combined with nutrition education. These findings highlight that improving child nutrition requires both the resource to make better nutrition choices and the knowledge to effectively use those resources. And the improvement that we see was linked to enhanced diets, particularly increased consumption of animal source foods such as eggs, dairy, and other items. From TMRI, we have seen that combining cash transfers with behavior change communication significantly improve both long-term household resilience and women's empowerment. Specifically, households had increased asset and income generation more than cash alone. There was a greater reduction in of poverty and sustained up to 4 years post-program. We also saw sustained reduction in intimate partner violence, which may be attributed to less household economic stress and improved women's empowerment. These households had better household food security even during the COVID pandemic 7 years post-program, likely due to prior investment in livestock and sustained improvement in food access. TMRI results align with findings from other studies in Bangladesh and beyond. For example, research on BRAC's Targeted Ultra-Poor program, the famous TUP program, it's a graduation program in Bangladesh that shows that asset transfer bundled with training and other support can lead to sustained reduction in poverty. Similarly, evidence from other settings demonstrate that lasting benefits from programs that provide substantial asset transfer or cash transfer combined with additional support. This includes asset-based multifaceted graduation programs as well as cash plus programs in other settings. Although multifaceted programs are typically more expensive to implement, their longer term and diverse benefit enhances their cost effectiveness. TMRI's impactful results have already shaped the design of large-scale safety net programs in Bangladesh. One notable example is the investment component for Vulnerable Group Development Program, or ICVGD. They followed the TMRI design. ICVGD was implemented by the Ministry of Women and Children Affairs with support from WFP, which aims to empower ultra-poor women by providing financial assistance to enhance income-generating activities and improve livelihoods. ICVGD has adopted several integrated components, including a one-time cash grant of 20,000 taka through the government two-person system, along with training on business skills, nutrition BCC, and monthly VGD food rations. Scaling up these programs with context-specific design is recommended, particularly in economically lagging and disaster-prone areas. While this presentation focuses on TMRI and its impacts, it speaks more broadly to the opportunity to leverage social protection to strengthen resilience by bundling interventions to maximize impact. IFPRI research shows that health-related shocks, like family members falling ill, are major drivers of poverty in Bangladesh. This is evident from our BIHS survey. Yet, no nationwide social health insurance program exists. In 2019, nearly a quarter of rural households reported health costs as their most significant negative income shocks, and none had health insurance. These health-related shocks push non-poor households into poverty and worsen conditions of already poor households. Given the catastrophic impact of healthcare costs, a well-designed health insurance program for both rural and urban poor is crucial and should be piloted and evaluated for its effectiveness. Health insurance systems are complex and require strong administrative and funding, making them time-consuming to establish. Health vouchers, however, offer a simpler solution to for direct access to the services, and a minimal infrastructure is needed, making them ideal for resource limited setting. In Bangladesh, programs like the maternal health voucher scheme has improved maternal and child health and increased health services use. Further research into supply and demand could enhance their impact, benefiting both rural and urban communities. To wrap up, here are few takeaways. First, long-term resilience and sustained benefits are more likely when transfer sizes are significant and are combined with other components that support income generation, like training or access to financial services. And second, social protection can boost resilience even further by addressing health risks, for example, also through social health insurance and health vouchers programs. Thank you for your kind attention. If you are interested in learning more about TMRI and opportunities to leverage social protection, many of these findings I shared are included in a comprehensive food security assessment report we recently produced. It has been circulated to the interim government and development partners. You can scan this barcode with your phone for access to, and feel free to reach out to us directly. Thank you. Thank you very much.
Thank you, Dr. Ahmed. We have the third paper. It's on inequities in nutrition intakes, intra-household dynamics. Presenters are Razin Iqbal Kabir and Sanjida Mesket Simi.
Good afternoon, everyone. So we will be presenting on inequities in nutrient intake, intra-household dynamics. And these findings are from the chapter of IFRI's recently launched Food Security Report that has been led by Dr. Akhtar Ahmed. So the first question is, do we have enough data to calculate individual nutrient intake? So let's explore. We have BDHS, Bangladesh Demographic Health Survey, that does not collect individual level dietary intake data for all household members. We have HIES, Household Income and Expenditure Survey, that collects food consumption at household level but not for all household members. So IFRI's BIHS, Bangladesh Integrated Household Survey, collects individual level dietary intake data for all household members. And BIHS is a nationally representative panel survey of households in rural Bangladesh that has been conducted over 3 rounds till date. And we estimate individual dietary intake data to estimate nutritional requirements that vary by age and physical status. It is very important for policy formulation and finding the right focus groups. So we have assessed both macronutrient and micronutrient intake as well as their inequities in intake using BIHS latest dataset 2018 and 19. So the dietary intake data were collected using 24-hour recall method and food weighing method. And we have included 19,1818 individuals for macronutrient intake analysis. And we have included 21,589 individuals for micronutrient intake analysis. We have also considered both pregnant and lactating women during our micronutrient intake analysis. So we have included individuals aged over 2 years or above, And we have excluded those who were sick, fasting, or away from home. And we used our latest food composition table for Bangladesh to calculate food items that were collected in grams to convert into nutrients like carbohydrate, protein, vitamin A, etc. And we used household consumption expenditure data to assess economic inequity. Now coming to the results, first we will be talking about the macronutrient intake. So as we can see in the graph that we have carbohydrate, protein and fat. So carbohydrate, protein and fat are the macronutrients. These are very vital and provide most of the calories to our body. And if we look at the carbohydrate intake graph, we can see that male household members have higher intake of carbohydrates than female members across all age groups. And the difference in carbohydrate intake increases as the age increases, and the difference in the intake is highest is 41 to 60 years age range group. And the findings are similar for protein and fat as well. We have also assessed intra-household dietary intake data in terms of wealth quintile. You can see here Q1 is the 20% of the poorest household and Q5 is the 20% of the richest households. So, and also you can see here the higher the inequity is, the value is closer to 100. So we will be discussing here for the protein inequity only because protein is very vital and its deficiency led to severe consequences. So from the graph, we can see that both male and female household members in the poorest households have insufficient protein intake compared to those in the richest households. Now, talking about the micronutrients, we will be talking about vitamin A and iron only, though we have a number of micronutrients. Vitamin A is very vital for growth, immunity, and normal vision, and iron is very important for preventing anemia. So here, if we look at the vitamin A intake graph, we can see that male household members have higher micronutrient intake in comparison to female members across all age groups, and the difference in the intake between male and female increases as the age increases. So the highest difference in the intake between male and female is in the 50 years or above age range group. And if we look at the iron intake graph, we see the similar thing. We see that the male household members have higher iron intake than female household members across all age groups. And the difference increases as the age increases between male and female. And the highest difference we can see between male and female in the 20 to 49 years age range group. And this age range is also very critical for female because this age range is considered as women of reproductive age. So if we look at this vitamin A inequity graph, we can see that two types of scenario here. So the first one is both male and female of poorest households have insufficient vitamin A intake in compared to the richest household. And the second scenario is female household members have insufficient vitamin A intake across all age groups and wealth quintiles compared to the male members. And if we see in the iron intake inequity graph, we see the similar results here. We see that both male and female of poorest household have higher insufficiency in iron intake compared to the richest household. And the second one is that the female household members have insufficiency in iron intake across all age group and wealth quintile compared to the male members. So now I would like to hand over to my colleague Razin Iqbal Kobir for discussing about the policy recommendations that can be implemented to overcome the issues. Razin bhai, please.
Thank you, everyone. Thank you, Simi, especially for a very fantastic overview of our findings on macro and micronutrient intake in households. And the disparities between across different wealth quintiles and also across gender. So these findings bring into focus several policy issues that need to be tackled to achieve good nutrition outcomes. So I'll now talk about how we can distill some of these issues into perhaps some actionable policy recommendations that we can for uptake. So arguably the most important issue that needs to be addressed is ending the intergenerational cycle of malnutrition, right? And a key way to address this would be to formulate strategies that can prevent adolescent marriage and early pregnancy in the first place. So high levels of adolescent marriage and early pregnancies continue to persist in Bangladesh. So first we must work to strengthen the enforcement of laws to prevent child marriage, while investing in community-based programs that can promote the rights and education of girls. Now, in Bangladesh, as we working in this sector, we know that policies and regulations, there's a lot of them. They exist. Many people have worked on them for many, many years, but implementation has historically been poor. What we need to work on now is truly enforcement. And with this current change, both in the political landscape and moving forward, I think this is a good time that we can do some of that. Secondly, there needs to be widespread social campaigns aimed at changing what can be sometimes harmful societal norms. So there must be increased emphasis on the health risks associated with early pregnancy, and families have to be educated on the benefits of keeping girls in school. So families need to understand, they need to be sensitized that this can be a future earning member of the family. And yeah, that should happen across the board. Now, alongside this, this sort of preventative work, we need to ensure effective family planning support for those who do marry early, to help delay pregnancy, early pregnancy following marriage. So we should follow this up also. I think what would be critical is to implement a school feeding program in secondary girls' schools, providing nutritious school lunches that can improve adolescent nutrition. And finally, for lasting impact, the government could consider providing a monthly take-home ration of fortified rice, protein-rich pulses, and fortified oils, specifically for adolescent girls from low-income households. So contingent upon their remaining unmarried. If they remain unmarried, you will get this ration. That is an incentive for households to keep girls in school. So this kind of strategy could help prevent early marriage and teenage pregnancy in the first place. So the next set of recommendations, the next set of issues that needs to be addressed are related to having a sustainable food system and improving nutrition knowledge, right? So to ensure a sustainable food system, we first need to promote agricultural diversification. In many of our presentations in the first session today, Akhtar Bhai especially mentioned that the need for agricultural diversification. Too much of our diet is dependent on rice. Most of the nutrients we absorb come through rice. Rice is really the vector for so many of the nutrients that we do have in our diet. But this can only get us so far. So we really need to promote agricultural diversification for the production of nutrient-rich, non-rice crops, livestock, and fish to enhance dietary diversity. So that won't happen overnight, right? So crop diversification requires that value chains and markets exist for these commodities, for diversified commodities. So developing strong value chains and market linkages for these foods can help manage price risks. We heard in the morning there were discussions that families don't want to diversify away from rice production because of the price risks and instability associated with producing other crops. If you can develop some of these value chains and ensure that markets exist for these value chains, for these commodities, then that can offset some of that. So we need to increase investment in agricultural value chains, from production to distribution to reducing post-harvest losses and enhance market access for farmers. Now, Next, we need to think about expanding fortification efforts. So addressing the barriers to expand the fortification of staples, right? So your rice, so especially we know about golden rice, and also distributing rice biofortified with zinc through public programs to reach the most vulnerable. There's some of the efforts that have been tried out in Bangladesh. They face various barriers, right? So the Bangladesh Rice Research Institute has been pursuing the NCB approval of golden rice since 2017, but it's still in the pipeline. It's still, I'm not aware that it still has happened. Yes, and finally to improve the nutrition knowledge of households, we really need to leverage nutrition behavior change communication. So we should consider implementing national education policies that incorporate nutrition BCC into the secondary school curriculum. We should also embed nutrition BCC within safety net programs to positively shape food consumption habits, dietary diversity, and infant and young child feeding practices. And finally, we really need to foster collaboration across ministries, so very relevant ministries such as the Ministries of Education and Health to develop appropriate nutrition education modules and train teachers in effective content delivery. Now, the key to achieving all of this really is to promote women's empowerment. So we really need to implement targeted gender-responsive agricultural policies, right? So the government should implement policies that can improve, that aim to improve women's access to productive resources and decision-making roles. IFPRI's research has found that if women are involved in decision-making for the household, then that improves the nutrition outcomes for everyone in the household. So this has to be complemented by investments in women's capacity building, combined with policies that support gender equitable land ownership and can increase agricultural productivity and nutrition outcomes. One way to do that is to integrate training and sensitization. So one very successful project that IFPRI has had in the past is the Agriculture, Nutrition, and Gender Linkages, or ANGEL project, which was designed and evaluated by IFPRI and implemented by the Ministry of Agriculture. And it combined agricultural extension, nutrition training, and gender sensitization. So evaluations by IFPRI indicated that the ANGEL project successfully improved production diversity, dietary diversity, and the overall quality of household diets, and empowered women in decision-making roles. And finally, as Dr. Bhai pointed out in his previous presentation quite clearly, that targeted cash transfer and nutrition education, so through the TMRI project, so social protection schemes such as these aimed at women can empower them economically and increase nutrition knowledge. So these measures enhance women's ability to influence household nutrition decisions. And with this, we conclude our presentation. Thank you, and we look forward to your comments.
Thank you. We have one discussant, Dr. Imran Motin. Floor is yours. 7 to 8 minutes.
Thank you. Thank you for those really good presentations. I'm going to focus much more on the social safety net, social protection side, primarily. Talk a bit on the nutrition because I know a bit more. I know very little about nutrition and just a bit on the social protection, so I'll focus on that. So the first, the first paper was on diagnosis of the problem, and the second was on intervention. And so let me start with the diagnosis of the problem. And I think diagnosis, we know that, this is the challenge, but how do we actually, what do you do about addressing some of these challenges, I think, is the main issue. And this is where I just want to share some thoughts. So firstly, this whole thing about trying to look at targeting effectiveness just from a poor, non-poor perspective in a context where you have deep vulnerability is not a very useful way of thinking about social protection. Because social protection should be about not only addressing poverty, but really vulnerability. And if you think about reducing vulnerability, then one needs to really bring in vulnerability far more directly in the analysis, and not the static poverty, poor, non-poor way of looking at the whole problem. And once you bring in vulnerability, the picture becomes much more complex. And the whole targeting effectiveness literature, or the targeting effectiveness diagnosis of the problem, then I think becomes far more interesting, right? So in Bangladesh, headcount poverty reduction has been happening very fast. It has been, since the 90s, it's been going down. But vulnerability has actually, has actually increased over time, right? We don't have temporal data on this, but particularly from COVID, since COVID, we know this, right? So right now, we're in this kind of a double challenge of actually increasing headcount poverty. So actually, the absolute number of poor people in Bangladesh right now is growing because, in the 2022-23 time period, this is a survey done by SANEM based on highest sample, finds that headcount poverty has increased about 1.8%, much more in the urban area, lower in the rural area, whereas population growth is hovering around 1%. So, absolute number of poor people are going up. But much more, I think, interesting is, this is some analysis we did for the white paper, where we find that if you shift the poverty line by 20%, then almost headcount poverty doubles, right? So in other words, 2 days of less work would basically mean another 20 million people will fall into poverty. Right now, there's about 30 million people who are in poverty, right? So that is the nature of vulnerability. And this is a very rough and ready, simulation exercise we did. World Bank did some more sophisticated analysis of looking at vulnerability. And according to them, 30% of the non-poor are extremely vulnerable to different types of shocks and falling into poverty. So our social protection imagination and ambition needs to really, address this complex canvas of vulnerability, right? And then we need to think about innovations, productive safety net, protective safety net, even pension scheme for the informal, right? All of that we need to think about, but the canvas has to be beyond just poor and non-poor, and this very instrumentalist approach of mistargeting as percentage of non-poor who are taking, who are sort of taking the benefits, right? So I think we need to move beyond that and make this much more sophisticated in terms of our understanding and policy and intervention design, really. My final point would be really around, kind of accountability. How do we, the whole mistargeting and targeting literature, coming primarily from the West, looks at means-based targeting or self-targeting, and these are very centralist mechanisms and mechanisms that are driven by stigma. Poor people are being targeted well because the stigma associated with lining up for OMS, right? So I think, how do we really turn this around and really think about social accountability, social ownership, local ownership around the poverty as a conditional problem, as a problem of injustice, and then address it with far more localized ownership in terms of targeting, in terms of designing, in terms of advocacy, and so on and so forth. And I think if there was any time when we can really be ambitious about all of this, I think this is the time, because this whole uprising has been an uprising of accountability. Thank you very much.
Thank you, Imran. We'll now have some open discussion. Can I ask the presenters and discussing to join me on the stage? Done? So, floor is open. Yes? Please identify yourself and ask your question. Can someone give him a microphone?
Hello. Assalamu alaikum, sir. My name is Shafkat Shafiq. I'm currently a student of Institute of Health Economics in Dhaka University. So I have a specific questions on the second paper presentations, which emphasize much on the health insurance for reducing the poverty rate. So my question is, can health insurance be actually accomplished in a country like Bangladesh, where if not most, then like almost all the people who are living in the poor people are in the informal sector, and they mostly have a seasonal income. And my second question is, even we see in the SSK pilot program, that means the Shastro Surakha Karmoshochi program, that even if you try, which focus on the people below the poverty line, we see that this program is almost not scaling up due to lack of coordination among different fragments of organization, because the health ministry or the health system in Bangladesh is fragmented in many organizations and many departments. The health ministry itself is fragmented into 2 divisions. So can this actually be implemented in, health insurance be implemented in a country like Bangladesh?
Thank you. We'll take a few more questions if there are any. Yes, just in front of you.
Assalamu alaikum. My name is Naushin Jahan Takia, and I'm currently a second year student of Department of Economics in University of Dhaka. So my question is for Dr. Akhtar Ahmed, sir. So sir, Bangladesh's recent fiscal policy is contractionary. So what does that imply for food security that is availed through social safety nets? And my second question is, given Bangladesh's rapid urbanization, how can social protection schemes be adapted to address urban poverty, which is often overlooked compared to rural poverty? Thank you, sir.
Thank you. Any other? If not, we will. Yes, there's one.
Good afternoon. I'm Dr. Afsana Habib from Helen Keller International, Bangladesh. Actually, it's not question, just one suggestion that it was recommended that if we can introduce a ration or like a social safety net program for adolescent girls. You know that from the previous long experience of the government, vulnerable group development, now it is converted to ICVZD, that means investment case vulnerable group development. That means with the ration, the involvement them with any income generating activities. So for adolescent girls, only rationing will not be that much sustainable if we do not actually involve them with any income generating activities. So what's your thoughts on this? Thank you.
Hi, hello, assalamu alaikum. This is Saika Shiraj, Country Director, Nutrition International. We have also been working on how to make the national social security strategy more nutrition and gender responsive, and some of the recommendations that came up today through the presentations are very similar that has been proposed to government, and they're working on it. But what my question is, when it comes to social safety net, making them more nutrition sensitive, I think what we are missing is the cost of inaction, and that is why all the policies and things being there, the implementation is not happening, or interventions like fortified food distribution and things are often being discussed to be taken off the table during different crises. So how, from a research perspective and policy perspective, you look at this and how our research should kind of answer some of those questions of, what the impact would be if some of these, mid-term and long-term interventions are not being implemented or scaled up.
Shahjadi, I'm currently second year student Department of Economics, University of Dhaka. My question is from presentation to how to balance the objectives of reach and size of transfers. And the another one is without substantial change in the business environment and expansion of financial markets, can transfer programs create sustainable gains? How does Bangladesh overcome the challenges like short-term economic shocks or long-term structural poverty in these dimensions?
Assalamu alaikum. I'm Aminul from IFRI. So my question is to Dr. Mutin that in your discussion you pointed out two important things. One is about protective and another is productive social protection policies. So given the current workforce structure in our country that beyond after 2040, most of our population will be much dependent on younger generations. So given that, how do you see that the social protection policies would look like in a longer term?
Assalamu alaikum. This is Mohammad Mukul Hussain, and I work with Global Alliance for Improved Nutrition Gain. So first of all, I'd like to thanks to the presenter. That was really brilliant presentation and insightful in terms of the SBCC and other things. I was curious that I was observing that all of the presentation really they emphasized on the nutrition education and SBCCs. So just I want to share one update from our organization that recently in GAIN, we are actually working with Cabinet Division and we have developed a partnership so that social protection program can be integrate SBCC in all the social protection programs, particularly focusing on nutrition. And the last thing that I want to give one suggestion, you may say that while considering the targeting and exclusion inclusion error consideration into the social protection, I think single registry or social registry is very important. That might be another suggestion in terms of beneficiary selection or targeting. So that's all from my side. Thank you.
Akhtar, you had a couple of questions. I just want to, is there a trade, how do you settle the trade-off between size, benefit size and reach? So that's a trade-off issue, right? There was a question on that. And also on the health, if you would like to answer, particularly given the informal nature of the poorer people, their employment, health insurance prospects in Bangladesh. And why don't you answer those two? There are some more.
Thank you. Well, this question is how, to increase investment in social protection, to benefit people, what would be the cost? What are the cost implications? You see, we have done an analysis, I have not presented it today, but it is possible within the existing social protection budget, this benefit to the vulnerable, the poor, can be increased substantially through some programs. We highlighted 5 programs, and there are some other programs also. You see, it requires like improving or expanding the reach of most effective programs and abolish ineffective ones. And there's a lot of scope to do that. And so we have done some research, and I think more research is needed to identify, these programs and also how much cost is needed. My sort of hunch is that we don't need $18 billion. We can do even less, but reach to much larger number of the poor and vulnerable. Okay, so that is, I think, we can pursue and yeah.
And the health insurance?
Oh, okay, health insurance. Now, health insurance, someone said that, yeah, it is complex. Yes, we had mentioned that. It is complex, but it is doable. Countries like, in the Philippines, they have this social health insurance program. They have been doing it for, quite some time, quite effectively. So I think it can be done in Bangladesh, but then, as I said, that a simpler solution would be health voucher program. So, distribute health vouchers to, targeted to poor and vulnerable. I will always mention poor and vulnerable, as Imran, suggested. And so that can be done. Health vouchers. So those who receive these health vouchers, they go to clinics, hospitals, to pharmacies to buy their medicine and produce the vouchers, and then these providers, they get the vouchers and then they redeem the vouchers from the government. So I think that is a more like practical way to address these health shocks. Thank you.
Okay, thank you. There was a sort of a semi-political question. I'll ask Imran or anyone else who wants to answer. Two political type questions. One is that the interim government is following a contractionary fiscal policy. What prospects do we see for social protection getting greater attention? There was one question. Building on that, there was someone else was also mentioning about that now there is this crisis time period going on. Can we really, how much will social protection be high on the political agenda? So I'll leave these, whoever wants to answer, Imran or?
So very recently, I think just after the July uprising, there was an uncertainty around social protection, continuation of social protection for a few months, and I was out in the field, and I know what kind of impact that kind of uncertainty, even this meager amount of money, is lifeline for many of these households, right? Especially old age allowance, widow allowance, these type of allowances are life education allowance. These are lifeline, right? And recently I've seen that there is clearly there's a targeting problem. We have a targeting problem. But is that the most, do we address the targeting problem by taking a technocratic approach and basically saying that, we need, household registry? Of course we need household registry, but is that really going to solve our social protection problem? Right? And I think that's really barking up the wrong tree. Right? I think what we really need is to really think about the fact that we have a lot of vulnerability. We did a calculation. So when we look at non-poor targeting error, it's about 70% targeting error, using Household Income Expenditure Survey 2022. If you just take that vulnerable non-poor, if you exclude them, it goes down to 30%. right? So there's actually, so I think there is a targeting efficiency to be gained, but not by poor, non-poor, but by thinking about in a more nuanced way, vulnerable, non-poor, looking at vulnerability, and that means dynamic targeting, which means you cannot do it just with statistics. You can, but the kind of data you would need for that is pretty huge, right? And that would become a cottage industry in its own right, multi-million-dollar industry. Much better to basically think about social innovations at the community level. How do we really use that to really solve some of these dynamic problems? So that would be my thing. And in terms of contractionary thing, I think this is where productive safety net is very interesting, because in the long run, productive safety net will wean off people out from other continual safety net requirement. Right? There's a one-off amount of big grants, big push, that, and along with some other combination of well-sequenced things, can help you graduate out of poverty. So that means for a portion, for a class of households, you do not need the long-term continual support. So I think this is where we need to think, how do we blend productive and protective safety net to be able to wean some people out of long-term safety net requirement, right? So that we create the fiscal space. But that is more of a dynamic problem. There is a political problem of how do we get, kind of space for those type of innovations to happen. But that is the only way we can basically move forward.
Thank you. Of course, there's the question of what are the design challenges for these productive safety nets, right? Add anything to, no. Yeah? So, Akhtar, you want to add something?
Yeah, okay. Now, I would like to point out to some analytical issues about poverty and vulnerability. As Dr. Imran said in his comments, that, if you lower the poverty line, then like millions of people, they are above the, they become, non-poor. The thing is, the distribution of this, that is cumulative density function that we usually do, we see this lot of poor people are just below the poverty line, right? And it is quite, easy or less costly for the government to improve, bring them up above the poverty line, okay? But the challenge is those who are at the bottom of that cumulative, density function, at the bottom of this distribution, is very hard to lift them. But that should be the focus. So we need to do the analysis. Who are these people who are like far below the poverty line? So not only head count poverty analysis, but we need poverty depth analysis should get more attention for that. Another analytical question is poverty dynamics, right? So people move out of poverty, people fall into poverty, but they're not the same people, who move out of poverty or, fell into poverty. So we did a poverty dynamics study using our 3 rounds of panel survey. Poverty dynamics, it requires a panel survey, right? So we found that many people, move out of poverty like in 7 years' time. Many fell into poverty, and some people, the situation did not change. So they were, non-poor before, and they are also poor after. So this kind of analysis is also very important, poverty dynamics. And as I said, BIHS data is a panel data, and so I think, the researchers can do more analysis like that using the panel data to see, who are the people who, move above the poverty line, who fall into poverty line over the time. And as I said, yeah, they're different people. So I think from the analysis point of view, that is quite important. And as I said, we have the data set to do further analysis of this poverty dynamics.
Thank you. Would any of you want to anything? Yes. Okay. All right. So I actually have one question to three of you, which you could just, Akhtar, you mentioned your program, BCC producing nutritional improvements, but in the bullet points that you showed, the nutritional improvement was in terms of better diets. There was a mention that animal source. So I was just thinking about what is the causality here between the behavior change communication and the improved diets, unless it is mediated through income. So I think, you don't need to answer, but I think in terms of now you have shown the relationship between BCC and improved outcomes. But I think then you will have to also provide an answer about the causality. Exactly how, because when you say that their nutritional income was because they were now having better animal source foods, that must be mediated through better income actually. To access that, it cannot be a behavioral. So what is the behavioral change contribution to improved? You have shown the relationship. I think in the next round, I would request that you have a look at this causality, because that would be a question otherwise, how to answer that. All right? You have a...
So you see that not always BCC cannot improve the nutritional status, because in our presentation you have seen that female members, those who have insufficiency in vitamin A intake and iron intakes, and they were insufficient in, even they are in the richest quintile. Because if they have had the knowledge of having diversified diet, having the micronutrient-rich diet, they, their nutritional status like vitamin A or iron could have been improved. So, when we are using, when we are designing the BCC, we also need to integrate with the nutrition knowledge. Otherwise, I think it is not possible to improve the nutritional requirements.
But another interesting thing that struck me in your graph was that, yes, females are worse off in terms of males in terms of nutrition intake, but pregnant and lactating women, their position is better than the average female.
No.
Yeah, I saw you can look up the data. The graph there, the amount is very clear that the lactating and pregnant women's data that you showed, or he showed, okay, it was higher than the average female intake, which would imply that at the family level, there is some attention to women's needs.
Yeah, that answer a bit, but when you pregnant women or lactating women, their requirement is, it's doubled or tripled. So
no, I know, yeah. I know. Not up to their requirement, but they are somewhat higher to the average female.
Yeah.
That's what I mean, that there is some sensitivity within the family to the needs of the pregnant and lactating, but it's not up to their total requirement.
Yeah.
Okay, I think we can close the open discussion here. From my side, I think the discussion was, we talked of data, we talked of analysis, we talked of policy. And I think in terms of data, as Akhtar said, poverty dynamics type of analysis may be more required. In terms of analysis, I think as Imran said, both just the below the poverty depth type of data, but the vulnerability, vulnerable non-poor above the poverty line, vulnerable to descent, those sort of analysis I think are required. But in terms of our thinking about social protection. I mean, we talked about should we increase the size of the budget on social protection? That's one concern. Some concern is about trying to reduce mistargeting. That's one type of concern. Integrating, bundling it with other elements like nutrition or other, training, graduation program type. So that's another thing we discussed. Urban came in, but urban actually requires urban poverty landscape requires a different type of analysis, much more mobile population, and the ability to deliver social protection in a context in which the population is very mobile. That is something, it's an operational challenge, how you do that. Many NGOs actually have found it difficult to pursue that, and it could be some other intervention windows that we should be looking at. I think a very important issue, I think Akhtar briefly touched on it, is, first of all, what counts as social protection? I think we need, from the research community, we need a stronger message to the government that please don't include everything under the title social protection. Certainly not civil service pensions. Certainly not construction of a stadium in a district. We did an inventory of all the social protection program, and you'd be surprised what goes into inclusion as social protection. So I think it's a much more very important that we really narrow down and understand what is being shown as social protection. The percentage, 2.5% is mentioned by the government, but if you do a narrower inventory, it will drop below, it will be more like 1.5% maybe, or even 1%. So I think those are important questions that we need to put on the table. The other is, I think a policy choice, particularly in this crisis period, particularly in 2025, the policy choice is limited to, are there additional funds or do you repurpose? I think the choice is between efficient repurposing and looking for additionality. So it's very clear that efficient repurposing perhaps is the feasible option in front of the government. Certainly looking for additionality is welcome and should be pushed as a political agenda, but maybe from next year with a new aspirational Bangladesh, we should be able to offer more for social protection. I think some solutions like the World Bank, the social registry was mentioned. You also mentioned it. Now, we are forgetting that there was a big attempt, an investment in something called the National Household Database. It has disappeared in silence. No one is talking about it. There was an investment. BBS doesn't talk about it. World Bank doesn't talk about it. It doesn't exist anymore as an issue because data is not there. So I think it's important for us also to keep these sort of track. The social registry initiative basically disappeared in a way. So we have to have a better look at this. In terms of many countries have progressed with an efficient and dynamic social registry, one which is continuously updated. Because if you don't update it, then it becomes of no use. So that initiative, I think, proposing those sort of initiatives from the research community can be an important issue. The health question has been mentioned, and I think the health voucher, I would caution against any major expansion of it because we have done many analysis of the health system as such. That's a demand-side intervention, right? The major problems also in the health sector is supply-side inefficiencies. So you may give a voucher, but then they don't get the service when they go to get the service. So as a whole, I think the health sector, there's a Health Reform Commission, many new ideas are coming forth. Certainly, there's one, I try to tell the advisor that there's two immediately doable social protection initiative, one on health and one on education. You mentioned the primary stipend. It's 100 taka from 2004. Its value is now perhaps 10 taka. It can immediately be raised to 500 taka. And there's an established platform. It's a large coverage. Delivery efficiency has not been a particular problem. So there is a immediately doable window to raise this. On the health side, what I see is that if PPRC studies on the health sort of challenges at the household level, a majority of households now have one member or more than one member who are chronic patients. And chronic patients have a regular expenditure, health expenditure burden, because they have to buy those medicines. So there is an opportunity for a health sector social safety net targeted to families with chronic patients. That's where perhaps the health voucher, etc., can be targeted there. That can happen. Otherwise, health insurance is perennially discussed in South Asia. In India, they have made some progress. Sri Lanka hasn't followed that route. Some other countries, in Thailand, these are success examples. They have followed that route. In Bangladesh, the prospects of health insurance hasn't been very bright for multiple reasons, but there are design challenges, but also the fact that dropout rate is extremely high in the insurance program which have been run. Someone mentioned the SSK, the Shastro Shuraka program. It is again another sad story that no one is now willing to talk about it. It is now basically not scaled up, it is also falling off the radar. This was meant to be health insurance for the poorest, rural poorest. But beyond 6 districts, it could not be scaled up. And in fact, the policy attention there also really have not progressed. So, I guess there was one point about, I want to just finish on that. Because there are some feel-good ideas which seem quite popular among people like us. One is preventing child marriage, which is a very important agenda. But the one that you mentioned, I think, was it in your presentation or one of theirs, enforcing laws, legal age of marriage. Now, we have done some field work, and it seems that the child marriage prevention narrative requires a wholesale new look at it. Because this legal age of marriage, enforcing that, actually it has gone nowhere, and you have now a pseudo-reality of people get married at 13, 14, but not officially registered. They officially registered when they become 18. By that time, they are mothers or even maybe thrown out by the husband. Child marriage as a social phenomena, particularly from the researchers and the NGOs, I would request, we need to have a more in-depth look at this process, where the barriers are happening. Because child marriage is unacceptable. It is against the empowerment of women. But the traditional advocacy agenda that we have followed of a legal age and let's enforce that has not worked. Produced perverse outcomes, actually. So that requires a wholesale new look at the whole issue. But thank you, everyone. And before we finish, we have to distribute some certificates. So I'll start with Dr. Akhtar Ahmed, who actually gets 2, I guess, because he presented 2 papers. There's one for Sanjita Masket Simi. One from Razin Iqbal Kabir. None for Imran, but I can give you my, this, if you like. Okay, thank you very much.
next session is going to be on trade. We hope to see you guys in after 15 minutes. Thank you. The next session will begin at 4:15 p.m. It is a panel session on trade and investment in turbulent time. We hope to see you.